So this is a diagnostic question now. Let's see whether you know the answer, A, B, C, D, or E. We've got a 74-year-old man that's got a number of frequent falls. He's got difficulty carrying food bags, and he slings them over his elbows. He's got difficulty opening jars of food as well. He's got problems with swallow. He's got regurgitation as well. He's got weakness in the flexor muscles of his forearm and quadriceps. No evidence of fasciculations, and reflexes are normal bilateral. What's the most likely diagnosis? Polymyositis, inclusion body myositis, MND, myasthenia gravis, or hypothyroidism. We're going to give you 3 more seconds. Have a think, have a consider about this 74-year-old man that's got lots of falls. He's got issues with weakness, swallowing problems, regurgitation, and he's got main issues are the flexors as well. No fasciculations and normal reflexes. Have a think. This particular patient, in terms of diagnosis, is IBM, which is inclusion body myositis, is the most consistent with that. So it's rare, it's an important subtype of idiopathic inflammatory myopathy. The main reason why it tells me is the fact that this affects older individuals, so over the age of 50, and also with the patterns of weakness, because IBM involves the distal muscles of the upper limbs, so the finger, the wrist flexors, and the proximal muscles of the lower limbs, so the quadriceps as well, which is exactly what we're seeing here in the vignette. Also, IBM results in dysphagia, difficulty swallowing, choking sensation as well, and it progresses over months and years as well. Now, why isn't it polymyositis? Okay, now I can see why you would think that if there is muscle weakness, and obviously polymyositis is due to an idiopathic inflammatory myopathy that affects the proximal muscles, both the upper and the lower limbs as well. However, what we see here, this is distal muscle involvement, okay? The finger, the wrist flexors, which is very unusual for polymyositis. And obviously for polymyositis, that is normally a disease of young people, not older patient population here. Now, what about IBM? We've discussed why it should be IBM, and one of the key things is dysphagia. It's present in well over 60% of patients due to the pharyngeal muscle involvement. Now, motor neuron disease. I can imagine why you might say this is motor neuron disease, and obviously ALS, amyotrophic lateral sclerosis, is a part of MND spectrum because of the muscle weakness, because of dysphagia. However, MND it causes fasciculations, this spontaneous muscle twitches, and that is why MND is not likely in this particular case. Also, if you have MND signs, you get muscle atrophy, you get hyporeflexia. This patient's got normal reflexes, so this would exclude it. Now, myasthenia gravis is also incorrect because myasthenia gravis is an autoimmune disorder of the neuromuscular junction, and that gives you fluctuating muscle weakness. So people get fatigability. They get worse at the end of the day. They get worse if you overuse the muscle again and again and again. So obviously you could get a bit of dysphagia and proximal muscle weakness. The distal muscle involvement is very atypical for myasthenia gravis. It's normally more proximal. Hypothyroidism could cause a bit of myopathy, okay? That's more proximal. This is all distal, so that's why the pattern of disease, the pattern of weakness is different.